guys, Suzanne here, physiotherapist at Embodied in Cairns, and I wanted to let you know a little bit about what craniosacral therapy actually is, because it's offered for 2 sessions on our retreat in March. So here we're looking at the skull, obviously, and all the different coloured bones are actually different bones of the cranium or the skull. So we see here we've got like our maxilla, we've got our frontal bone, we've got our sphenoid. Basically, we used to think that where these were joined, that they were completely jammed together. Now what we realise is that they actually do glide gently against each other. Now that's important in some of the stuff that we do in craniosacral therapy. Another little thing to tell you about craniosacral therapy is what we're really assessing for throughout your system by feeling your tissues is areas where you might have trauma held within your tissues. Now that trauma can be physical or emotional. In fact, Norman Doidge, who wrote The Brain That Changes Itself, he recommends things like craniosacral therapy, kinesiology, and other different modalities for releasing emotional trauma that's held. So the purpose of our Emotions in Motion retreat is that we gain some connection, that we release ourselves, that we renew, that we revive ourselves, and basically that we can unknot those different areas of trauma through the medium of craniosacral therapy, art therapy, yoga, and just connection with other people. So what we tend to do is we don't actually just assess around the skull. My lovely model Jude here, I'm just going to demonstrate how we do a little starter assessment with craniosacral, but basically your body tells us where we need to work. So with craniosacral, we've got a number of listening points in the body, and we apply a really, really light touch, and the aim is we're basically trying to bypass the limbic system, which is a big emotional control center within your brain. So sometimes firmer touch modalities like massage and so on can actually really fire up the limbic system. What we're trying to do is we're trying to really calm the nervous system down. So a lot of us spend a lot of time in our day in the fight or flight response, or in a lot of sympathetic overdrive, like we're very stressed, we spend a lot of time in traffic, and we're really busy, and we're always go, 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 and we don't take the time just to be calm and relax. And what we're trying to do here is we're trying to just reconnect and see where we've got any imbalances within the system, maybe where that cerebrospinal fluid rhythm, so your cerebrospinal fluid is like your nervous system's natural lubricant, and it has a rhythmic flow in the same way as you've got heart rate or respiratory rate. We're trying to see where there's any imbalances within that rhythm, and we can find imbalances often between sides. So a lot of the time, for example, if you get somebody who's had a lot of injuries on one side or a lot of particular traumas, they can have imbalances between one side and the other. You might find that one side there's very, very poor movement. See here with Jude, her head is rotating towards my right, your left on the video. I'm not actually moving her head, I'm just following that normal movement of her fascia or her connective tissue. So we're just letting her go into that movement. And sometimes this constitutes something called a somato-emotional release, which is a release within the tissues of some of that inbuilt trauma. So what we do over the course of, generally the treatments are between kind of 45 minutes to an hour, is we feel at these listening points to begin with, and then we treat what we find. So the closer to your head, or I guess the start of the cranial system, that we find a blockage or a lesion, so whether that manifests itself as tightness within the fascia, whether it manifests itself as cold area or heat, or if we just don't actually feel a nice strong craniosacral rhythm, the closer that lesion or blockage is to your actual cranium or your head, the more effects it's going to have on your system. And John Pledger describes those effects as anything from sort of stress and anxiety and other more serious mental health dysfunctions to things like allergies and pain and so on. So sometimes we'll sit in quite a long period of time in one position. But basically the treatment itself is really relaxing. It's really a nice chance to kind of just tune into your body and see what you feel. A lot of people describe it as quite like Reiki, but I guess the way I explain it is it's we are working in a really structural manner. But you know, everything is an energy, so we're always having a transfer or release of energy, and when we get this craniosacral release, that can manifest itself in the body in heaps of different ways. So, you know, it can manifest in the relief of pain, or sometimes a feeling of more fullness within the skull, or just a feeling of intense relaxation. So hopefully, when you have your first craniosacral treatment within the first couple of days of the retreat, we'll identify a few areas of tissue trauma or some blockages and let you know what's going on within your system. And then when you spend your week doing all the really fun, connected and spiritual and reviving activities that we're doing, then when we go to do your craniosacral treatment before you go home, you will feel lots different. You and I will both notice a big change within your system. And that's pretty much it. But comment below if you've got any other questions, thoughts, comments on that, and we'll speak to you soon.